Oh, thank you, Madam Deputy Speaker. And I'm delighted to speak about this new mental health bill, which follows up the Mental Health Act that's as old as our Secretary of State. So that's good too, as we heard earlier. So what I'm hearing from throughout the House really is mental health affects all of us in some way. It always touches all of us, either personally or people we know really well. So I'd just like to really concentrate on some of the aspects of this bill. So what I welcome in this bill is greater protection in general, and especially people with learning disabilities. I also really welcome this early intervention, this stress on out-of-hospital care, and also the idea of advanced choice, because one of the things, particularly when people have repeated psychoses, is that when they're well, they know exactly what they want. When they become ill, they become paranoid of their family, they can become paranoid of their friends, and they aren't rational. And that's one of the reasons why sometimes they do need to be detained under the Mental Health Act. But if they have an advanced choice, at least they can say what they would like when they're in a normal state of mind. And I think that's really important, and I'm looking forward to that. I like the fact that the police stations are being removed as a place of safety. I am quite concerned how 135 and 136 sections of the Mental Health Act are being used, and I notice there's some schemes where mental health workers are going out with police and working together, and I think that is incredibly crucial. I had an experience personally where a close relative became extremely unwell, and although it's not quite as awful as what happened to the member for St Neots, this close relative was first of all sectioned in an A&E department, then they couldn't find any beds for 48 hours. So this poor relative of mine, and indeed the heroic nurses and consultants, had to look after someone who's acutely psychotic. This simply isn't tolerable, really, in our system. And I think we need to find a place very quickly for people who are mentally ill and make sure they get the best treatment to help them get better quickly. And also, protect the rest of the NHS from that. And after this, this close relative of mine was moved to a bed 140 miles away from her family. And so what we must ensure is we must get more sufficient beds and also more local provisions. And I know this will take time, and I know that at the moment mental health is not in a good state. And what I respect with this Act, and I'm really hopeful with our new Labour government, is we can change that so people do not have to travel out of area for that. I'd like to say a couple of brief things about crisis teams. I'm really impressed with the idea of these crisis hubs. I've worked with the Stroud crisis team for many years as a GP, and I've always felt actually that given a bit more strength and a bit more resource, they could keep a lot of people both out of hospital and not sectioned, but they need that resource, and they need the ability, and they need the close working with consultant psychiatrists. I certainly will, yes.
There you are.
Thank you to my honourable friend for that comment. And I think that's certainly true, but I think we need to be careful here, because part of that is about current resources of mental health and not about the Mental Health Act. And I think we mustn't blur the two. I think that the current government is putting 8,500 mental health workers into the system, and I'm delighted about that, and hopefully that will prevent those sort of waits that people have to have for mental health assessments. I'd like to, a couple of other quick points. I'd like to talk about appropriate medical treatment, because that's discussed in the bill, and therapeutic benefit. And I'd like to point out that 8.7 million people in this country are on antidepressants. About 25% of them are trying to get off antidepressants. The harm these drugs can do, they can have an increased risk of suicide when you first go on them and when you're coming off them, as we saw in a couple of recent tragic cases. There's also quite long-term sexual dysfunction, and I'm asking the MHRA to put proper warnings on their leaflets around this. And I'm also asking for a special service to help people come off antidepressants, because it's extremely difficult, and most GPs aren't that well informed about the best ways of doing it. It has to be done extremely slowly. The member for Whitehaven was also talking about ADHD and autism, and what we do about neurodiversity. And I also feel that we need to be extremely careful in the mental health services, that we don't over-medicate people with so-called neurodiversity. And I'm looking forward to speaking to him about this. And actually, I had to nip out from this meeting for half an hour to talk with the head of the task force for neurodiversity. They are going to report in July, and really what I think they need to do is get a much more supportive service and not go straight for medication, which is what seems to happen when people get referred to private psychiatric clinics. So at the moment, the amount of Ritalin-like substances which you treat people with ADHD has increased by a factor of 500%. And what's interesting as well is that increase is in social class 1. So it's not in social class 5, it's in upper social classes. And so there's something happening here which we need to get a hold of, and we need to provide proper services for people with ADHD. So very briefly, the other thing I want to talk about, and I was interested in the comment from the member for Godalming and Ash about families. Families in mental health are absolutely crucial. And I'd like to perhaps adapt this act slightly to make the families much more central and responsible. And I think that the idea of families can extend to certain others, which the person, when they're well, can nominate. But I do think families are a crux in a lot of psychiatric care. And if you must value their input and involve them in that. So, in summary, this is a really, really good bill, and it's about time we had it. I support all its greater protections, and I do believe it will actually reduce the number of compulsory detainments. Thank you.